My name is Joseph Paris, and I encourage healthcare professionals and patients to recognize that cancer affects not just your physical body, but your mind, your heart, and your spirit as well. Not only does cancer itself have a profound psychological effect, but it is the treatment of cancer that is equally traumatic and often overlooked. The side effects from chemotherapy treatment cause varying degrees of sickness and, in some cases, extreme discomfort for the patient. This condition can last for days after chemotherapy drugs are administered. This is only one example of how the physical side effects can deteriorate a patient's mental well-being. A common misconception is hair loss, in comparison to physical pain, is somehow less of a concern when the patient's life is hanging in the balance. Yes, it is true. If we had a choice between physical pain and hair loss, the obvious choice would be hair loss. The difference is, a chemo patient doesn't have a choice. They do in fact experience both physical discomfort and hair loss. Just because hair loss as a side effect does not involve physical pain does not mean that it is not equally traumatic. In fact, hair loss can be even more psychologically traumatic because the physical discomfort subsides in a few days after treatment. Hair loss, however, is prevalent until the completion of treatment. It will take 8 to 12 months for a patient's hair to regrow to a cosmetically acceptable length. So the mental trauma of the side effect of hair loss is with the patient long after the entirety of the chemotherapy treatment is complete. I know from my experience in dealing with thousands of people undergoing chemotherapy treatments that it is a fact that if the patient looks in the mirror and sees only a wig, then that wig is not therapeutic for that patient to wear. The hair must look real in order for it to feel real. And by preserving a patient's pre-treatment appearance, it supports them psychologically, opposed to the emotional insecurity one feels when wearing a wig that looks unnatural. I am proving my theory with facts and applying them to my concept. From the holistic and psychological standpoint, the MHP system is in fact an integral part of the chemotherapy treatment and should be a mandatory practice in the battle against cancer. Awareness to the truth of my claim must be brought to the attention of doctors, patients, and insurance companies across the country, and ultimately around the world.